What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. And if you're sick with something else, because other viruses, let's face it, they're starting to increase. You'll see it today. I hope you tested negative for them as well, and I hope you just have a full and speedy recovery. It is time now for the Friday edition of the Virus Update for Friday, October 25th, 2024. If you're new to my channel, welcome to today's Virus Update. You just clicked on to where I do news and data for all these different viruses and a few other things in between. Let's face it, there's a lot of viruses out there, and as of lately, the news has been starting to increase once again. Today will not be any different. Today is a very busy news day, and there's a lot of data as well, a lot of things that are new that I have not showed you in the past few days that just came out within the last, we'll say 18 to 24 hours since our last video. And here we are. We're only at 2:30 in the afternoon. I know. What else is going to come out today as we head into the weekend? Of course, if other stuff comes out, we'll get to that over the weekend because I try not to miss a day. Yeah, we've missed a few days with these updates, but I try not to miss a day to keep you informed of what's going on. So want to stay informed? Subscribe down below. Give this a thumbs up. Hit that notification bell. And share this video with anyone you know. Alright, let's get right into things. We have a ton of things to look over today. Starting off with this, we have more human H5N1 cases. I know, they just keep popping up left and right. Was it not just last Sunday we talked about the state of Washington? Well, they're now adding 3 more, bringing the state's total to 7. And so far this month in the United States, there have been 22 human cases have been reported in the U.S. So far this month, all are linked to poultry or cattle. So far, we're not talking about human-to-human transmission, but you do remember prior months where we did have some where we can't really figure out where they're coming from. So, yeah, H5N1, as I have been saying all along, and I'm going to say it again now, just continues to evolve, and who knows, we'll have to see what comes of this. Also, moving on to the E. coli outbreak. Remember, E. coli linked to McDonald's? Well, it turns out it is being caused by onions now is what I am hearing. And the number of cases linked to McDonald's is up from 49 and has gone up to 75. So that number continues to rise. All right, over in Japan, pretty much going to just read a headline here. Japan COVID deaths 14 times higher than that of flu after guidelines lifted. So what they're saying is, they're saying that after the guidelines were lifted, more than 30,000 people in Japan died of COVID-19 in the first year after most coronavirus-related guidelines were lifted. You know, masking, crowd size restrictions, all those type things, precautions that were put in place to help slow the spread. So, yeah, and it turns out that figure was over 14 times higher than deaths caused by influenza during the same period their government data showed on Thursday. Yeah, wow. That's just not good. All right, we do have a few illness announcements, and this one is related to Broadway. Death Becomes Her cancels second Broadway preview due to illness. Then we have Mickey Guyton is devastated to cancel shows amid, quote, illness, promises more info. Yeah, maybe she'll say if it's COVID or not, or flu, or whatever it is, but it sounds like here, if you read on, it says here, unfortunately, I'm sick and lost my voice, so my shows tonight and tomorrow are canceled. I'm devastated. I won't get to play for you this week, but we're working to reschedule, and I hope to have more in for you on that soon. I made a tweet the other day, or a post as we call it on X now. I made a post. When the positive for COVID and illness announcements, I've only seen one positive for COVID announcement this week, but when the illness announcements start increasing, along with positive for COVID announcements, that's usually one of the first indicators that things are starting to change. cases are starting to rise. And in this case, now in the summertime, we know it was likely COVID. But in this case, because we're entering into winter, there's a lot more viruses at play. I mean, you can get flu, you can get all these other viruses any time of the year, but it's more likely you get flu or RSV in the colder months. And right now, those viruses are starting to be on the rise, which indicates to me, yeah, when you're getting the rise of illness reports. I mean, we've had quite a few of them. There's been some that I've shared on X and Blue Sky that I haven't even talked about here because I figured they're just lesser known people that you probably wouldn't be interested in. But the point is, when the number of those reports start going up, that's an indicator that things are starting to be on the increase. All right, we do have wastewater scans, weekly thread. I think we're going to save this for the weekend just because I have so many more things to get through today. And heat-related illnesses, we will skip over that. I think we're going to retire that, or at least put it to sleep in hibernation until the spring. National Allergy Map. 62% of the country is in low status, and I think we may also retire this, or at least put this in hibernation for a while soon as well. You can see there's a lot of yellow in the southern states like Texas, New Mexico, Arizona, some in Florida, Oklahoma, even some in Arkansas, and portions of Kansas. But for the most part, the majority of the United States is now in the green status, which is some great improvement. However, this is not good, and this will be an all-year-round thing that we look at. Take a look at air qualities. I figured the West Coast, when I last looked at it about an hour ago, it was really bad. And there it is. You can see here. Look at all these reds just lined up right along that Interstate 5 corridor from Portland, Oregon. You even have yellows and oranges in Washington. And then you come down to California, like Sacramento. We still have a lot of red and purples, even oranges, just not good. Then in the southeast U.S., we have a lot of oranges and yellows as well, which is not good either. So there are some bad air quality levels, and I think we're going to see some bad air qualities potentially tomorrow. I shouldn't say I think we will, but I think the potential is there because tomorrow the wildfire risk is much higher than normal along that I-95 corridor in the northeast. The Storm Prediction Center is actually putting an elevated risk of wildfires because it's been so dry. Why am I talking about that? Well, that's because wildfire smoke is one of the leading issues here in the United States causing bad air qualities. It's part of the problem on the west. It's also part of the problem from time to time in the east, and it's something we're going to really have to keep an eye on. I mean, we're in a severe drought here in southeast Pennsylvania and in the mid-Atlantic region, so wildfires, yes, they are definitely a thing. All right, taking a look at this, here's my other account over on X, Climate Data Report. You can also follow that over on Blue Sky, and I think more people are starting to switch there because if you notice here, it's not growing anymore. But also, I haven't tweeted anything there in the past couple days, or at least I haven't tweeted much, I should say. And you can also follow me over on my other channel here on YouTube. Not going to get a video out there today. I think I will either tomorrow or Sunday will be the next video. That is Climate Data Report, all things weather and climate. Philadelphia, a day below 800 EMS calls, but just one below, 799. So that's still a lot of EMS calls, and if you're wondering, wow, that seems like a really high number. Well, actually, we've had many days this year. We've had dozens of days this year over 800, and we've even had a couple days that go over 900 EMS calls. We have one of the busiest fire departments in the nation, and EMS calls are a big thing here in this city that I live in. All right, taking a look at Montgomery County, Pennsylvania EMS calls, we do see there are quite a few of them right now, but I do take note here. I'm seeing vehicle accidents show up not once, twice, 3, 4, 5, yeah. And look at this, yeah, there's a lot of accidents right now, but there's also other things as well. Lower Marion Township, Pennsylvania, there's a stroke at the moment. I'm seeing cardiac emergency a few times, so there are calls to be had. Let's take a look in at Chester County, Pennsylvania, and we just see a lot of general, typical stuff, falls, lift assist. We're not seeing any of those respiratory difficulties, cardiac arrest, cardiac emergency. We're not seeing a high number of those right now, which is a good thing. There is just one heart problem call and one sick person call. And that's one of the reasons why we look at this. We look to see, are there a high number of sick person calls or respiratory difficulty calls? And if so, then we start to get concerned At the moment, not concerned, but that can change at any point in time during the day. Let's take a look at what's going on in Canada. COVID viral activity level is low, flu A is low, flu B is not detected at this time, and the viral activity level for RSV is moderate at this time. Staying international for just a moment, let's take a look at what's going on in the UK in case you missed it yesterday. The cases did drop slightly this week. It was 3,067. That is down by 446. Weekly deaths, however, did go up 199. That is up by 36 or 22.1%. Patients admitted 2,622. That's actually up by 149, up by 6%. And you can see here, they did make a little change here. I don't even remember. Did we show this yesterday? I feel like we might have missed showing the UK yesterday. Anywho, we can see cases did come down somewhat, but they do this sometimes where they drop now and then around the holidays they go back up once again over in the UK. All right, Walgreens this week. National positivity trend is, for COVID, 16.2%. Last week was 17%, down by 0.8%. Testing did drop, but if we zoom this in, we can clearly see here the positivity rate, it's not dropping as fast. And we're about close to seeing a flip to rising. And you see, there are some states that have already flipped to rising. Taking a look at something else that's slowing with the drop, and this is emergency department visits for people diagnosed with COVID. You can see here, these levels here, have been dropping, but not as fast. It has slowed off a little bit. I don't think we're at the point yet where it's going to flip to rising once again, but that's not too far off in the future. Over the weekend, we will go state by state to all the states shown. There are some states that are not included in this list, or some that are, but just don't update. All right, moving on to more new data from the CDC. Wastewater this week. 0 to 19% COVID detected. You know, that's these really low levels of COVID on the map. Yes, we can check for levels of viruses in wastewater. And in this case, we can find out what goes on with COVID levels at wastewater treatment facilities. Now remember, on this map, it does not include any of those places that are using septic tanks or not connected to a sewage system. So really dark blues, that's really good levels, 0 to 19% COVID detected, and that number is now up to 408 sites. We like to see that number higher because it detects low levels of COVID. And nationally, right now, you can see here, things continue to drop, but again, that drop has slowed a little bit, and the national wastewater viral activity level in the United States is currently listed as low. All right, let's take a look at wastewater scan for just a moment because I want to show you something here. Nationally at wastewater scan, COVID levels continue to drop. That's good. RSV, it continues to rise. Influenza A overall is starting to rise. Influenza B, very low for influenza B, not even over 1 yet, but it is starting to rise slightly. Norovirus is trending higher at this time. All right, moving on. We have more CDC data, and I need to show you this. This is the epidemic status. We'll start off with COVID first, then we'll go down to that influenza numbers. It is starting to grow, I should say likely grow, in several states. New York State, Michigan, Ohio, Kentucky, Tennessee, Arkansas, Georgia are now likely growing for epidemic status with COVID. It is still declining and likely declining or not estimated in several places and also not changing in several places. We don't see that growing color yet, but we do, again, see several places starting to likely grow. And when we come down to influenza, things are a little worse here. Epidemic status for influenza is growing in several states, such as Massachusetts, Pennsylvania, Ohio, Virginia, North Carolina. It's also growing up in Michigan, Louisiana, Texas, Colorado, and Arizona. It's likely growing in California, Nevada, Oregon, New Mexico, Illinois, Indiana, Kentucky, Tennessee, Georgia, Massachusetts, and in Rhode Island. And then we have just a couple places still declining, which would be New Jersey, and then likely declining still in Arkansas, and everywhere else in between is not changing or not estimated at this time. And Yes, that's all we can take a look at here. They don't do epidemic status for RSV, at least not on this page. Maybe there's something else for RSV, and we can include that in future videos. All right, drum roll, please. This is big. We have a new COVID variant update, and I have to tell you something. I think XEC is trying to end variant soup. Let me explain. KP 3.1.1 is still 57%. You see, that didn't change all that much. But XEC is now up to 17%. KP 2.3 is down to 5%. MC.1 is down to 5%. LB.1, 4%. KP.3 is 3%. LB 1.3.1 is 2%. KP.2 is 2%. And KP 1.1.3 and JN 1.18 and LB.1 is down to 1%. I think we're slowly starting to see variant soup go goodbye for now because there are much less variants here. XEC eventually will be the dominating variant that overtakes KP 3.1.1. It's not a more severe variant, but it's just a variant that can outpace the other one. So in other words, it's a sub-variant that replicates faster, and in turn will just overtake KP 3.1.1 probably at some point. I don't know. Late November? At some point it's going to pass. Maybe early December. Could be Thanksgiving, what really does it here in the United States. Alright, taking a look at influenza-like activity, and we do now see that there are moderate levels of it again in Washington, D.C., and we do have several states now that are listed in low, which would be New Jersey, Connecticut, Virginia, and Ohio, and Indiana. Everywhere else is on the higher end of minimal or the moderate area of minimal. To say the majority of the country is still minimal, but we're starting to see some coloring show up on this map, and I think as we go on now, things are going to fill in more. Halloween's coming up next week. That probably will likely be something that fills this map in a little bit more. Same with COVID. That's definitely going to lead to some COVID transmission as well. All right, now some data from CJS A3172. And this is first starting off with daily and weekday reporting states. Florida, 375 new cases and 38 new deaths, a number of which were from July. Yeah, figure that one out. New Jersey, 183 new cases and 13 new deaths. New York, 774 new cases. Weekly reporting states. Alaska, 134 new cases and 2 CDC reported deaths. Connecticut, 798 new cases and 12 CDC reported deaths. Georgia, 1,288 new cases and 18 new deaths. Iowa, 7 new CDC reported deaths. Kentucky, 1,135 new cases and 19 CDC reported deaths. Massachusetts, 1,040 new cases and 22 new deaths. Minnesota, 1,284 new cases and 15 new deaths. North Carolina, 399 new state-reported hospitalizations and 27 CDC reported deaths. Nebraska, 318 new positive tests and 11 CDC reported deaths. That's a lot of deaths for Nebraska. New Mexico, 948 new cases and 6 CDC reported deaths. Ohio, as I mentioned yesterday, 2,751 new cases and 18 new state-reported deaths. Oklahoma, 13 new CDC reported deaths. Rhode Island, 4 new state-reported deaths. And Vermont, 149 new cases. That's not the bad part. 7 new deaths, which, as he says, is another high number for that state. And I should probably do some research and see per capita where they rank against other states just for this year, because it seems like with the summer wave and even now they're having a really rough go of the deaths. I mean, this is just not good for Vermont whatsoever to be seeing so many deaths. All right, we just have a couple other things. I think we'll get to Los Angeles and California in tomorrow's video because, quite frankly, we've gotten through a lot today. New Jersey, 65 hospitals reporting out of 70, and that equals 230 hospitalizations, 7 people on a ventilator, 32 people in the ICU, discharges 37 at this time. In New York State, 629 people tested positive, and when you take a look here, you can see here, though it's still dropping, that drop has really slowed off in New York State. Taking a look at New York State hospitalizations, 589 people hospitalized and 61 people in the ICU. Alrighty, before I let you go off and enjoy those weekend activities, which I hope you do safely, I have to remind you that if you are going to be celebrating a Halloween party this weekend, please take precautions. Have an air purifier running. I got one behind me. Make sure you have it running. And yes, I know, you need to mask. And no, I don't mean a Halloween mask. You need to mask. And please, if you do put this mask on, don't put a Halloween mask over top of this. That's not necessarily a good idea, but an N95 mask does work. And hey, maybe you're going to go as a doctor for Halloween. If you're going to go as a doctor for Halloween, guess what? An N95 mask would make a great addition to the costume. Alrighty, as noted, we will get to California and LA tomorrow, and who knows, it's only middle of the afternoon. I'm sure a lot more stuff is probably going to pop up, and we're going to have probably a news-filled weekend ahead. We're giving updates tomorrow and probably on Sunday as well. I will see you all again next time. Until I see you again next time, stay safe, everyone. Subscribe if you're new down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. See you again next time. Stay safe. Have a fantastic weekend, and thanks for watching.